Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Palladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Welcome back to the Tongue Tie Experts podcast. I'm your host, Lisa Palladino, and today I am thrilled to talk to Katie Clark, also known as the Breastfeeding Mama. I've been following Katie for a very long time on Instagram, so much so that I feel like even before we start this chat, I know her because she's just someone I see every day on my feed. And I'm sure many of you feel the same. And if you don't already follow Katie, you should, because she's got a great presence on social media and lots of interesting and educational and fun stuff. So Katie's a proud mother of 3 little boys who happens to love all things breastfeeding. Through her own breastfeeding journeys, she has discovered the joy that comes from helping other mothers meet their breastfeeding goals. She's a certified lactation educator, certified breastfeeding specialist, and IBCLC candidate. Yay! Along with the various online breastfeeding groups she's led since 2015, she enjoys providing realistic and entertaining information about breastfeeding to help new parents make the best decisions for their families. Welcome, Katie.
Thank you. I'm so happy to be here.
And a couple of things stand out for me in your bio. First of all, the fact that you say help them reach their goals, right?
Yeah.
Like, I think that those of us who provide breastfeeding support often get a little bit of a bad rap as far as being like crazy breastfeeding ladies, right? Like, I just watched a TV show that had like a very poor representation of what a breastfeeding support person was on their TV show. And I was so frustrated. And, we're here to help families meet their goals, right?
Yeah,
I mean,
absolutely. I find that too. And I see so many people, they have all sorts of terms or whatever they want, whatever they call us. But
yeah,
it's frustrating to me because I'm like, that's not how it has to be. And and some people like maybe those ones are great for some certain types of people, but I've always been like very passionate about just helping people where they're at and not, having any
Mhm.
guilt, because that's it's like such a vulnerable and a hard time. And I think some of that comes from my own experiences where I have worked with lactation consultants that are a little more
Yeah.
aggressive. So but I
Yeah.
think most of us, like you said, just want to help people find what works for
Mhm.
them.
Yeah, and not to generalize, but, and no offense made to anyone that was a La Leche League leader way back. It used to be a little bit more stringent.
Hmm.
You weren't allowed to talk about bottle feeding. It was before, they were just taking care of families where the mom was stay at home and there was no working and stuff like that. So I think that unfortunately, sometimes that's how we're remembered. That's how the field is pictured.
Hmm.
But there's so much evolution
Absolutely.
since the field
Oh,
started.
and even in the last 10 years since my first son was born, I feel like there's been such a huge change,
Yeah.
which I think is really
Yeah.
positive.
Yes, absolutely. And, one mother, one family at a time, right?
Mhm.
We're making changes. It's the same with birth practices,
Yep.
right? I'm a midwife and we can only do one at a time and meet them where they are.
Hmm.
And sometimes even in a family, each child can get you closer to what your goal had been, right?
Absolutely.
Like you learn more and you learn differently with each child.
Yeah, no, I
Yeah.
agree. I have 3, so and I'm by no means an expert still, but I feel like especially when it came to breastfeeding, by the time the 3rd one came around, I had a lot more knowledge. I was a lot more willing to stand up for myself and what I thought was right, and I felt a lot more confident in my ability to breastfeed, because I always say
Mhm.
if I had the same problems with my 2nd and 3rd that I had with my 1st, I would have quit within days for sure.
Mhm.
And so
Mhm.
I think you just learn by experience and by more people you talk to.
Same, yeah. And, yeah, I finally got it, quote, unquote, "right" with my 3rd,
Mhm.
and even that, like I mean, she's 21, so when I look back on what I thought was the right way to breastfeed, quote, unquote, back then, ugh, I wish I could start over,
Oh, totally.
But you know better, you do better,
Exactly,
right?
I always say that because I feel the same way. I'm like, "Oh, if I had only known this or done this," or
Yeah,
yeah, you
yeah.
can't live in the what ifs. It's the move forward and you help others. And
Right. And, so the reason that I asked Katie, for those of you listening, why another lactation person on the podcast? I know that people are asking. But one of the things that I think is very important for everyone to know is that we may have all this experience and knowledge and know how to guide other people, counsel other people, assist other people with their breastfeeding challenges, and know all the, textbook ways to do things. But that doesn't necessarily mean that it's all going to be perfect in our own experience. So you have the experience of 3 different kids
mhm,
and 3 different experiences.
absolutely.
So I think that today would be great if we could just chat a little bit about what those challenges were. If you're comfortable saying what where you think things like, where you didn't reach your actual
Mhm.
goals and, what you would like people to learn from your own experience. And I think that would be very
Yeah,
helpful
no, I love.
because, social media days, as we were saying before we got on, it looks like we've all got this right,
Yeah.
right? Like if you're looking at the social feeds. And even those of us who've got great presence on Instagram and look like we got it all together, behind the scenes might be a little bit different.
Oh, absolutely. And that's something I feel really strongly about, is not putting up a front, because I think that that just does
Mhm.
more damage. Just yesterday I put on Instagram on Mother's Day, I'm like, stop worrying about what the, social media people say is the perfect, parenting. Cause like I get in that trap where I read something, it's like, you have to be this type of parent. And then I'm like, I'm just messing up my kids. So why even try? So then I'm like, that's not, it's important to be real, and it's important to show that weakness, and that we all have struggles. And that's really where my breastfeeding like passion came from, was from the struggles I had, and recognizing just that there were not very good resources. And
Mhm.
I realized I was very fortunate in my situation because I was able to kind of figure it out. I had good support network around me. But I realized a lot of people don't have that and probably wouldn't have had the same opportunity I had to kind of work through things like I did. And it
Mhm.
was still really hard. So
Mhm.
I just think, I always say we go through hard things for a reason, and a lot of that reason is to help others.
Oh, I love that you've turned your experience into helping others. And I say the same thing about, I don't teach what I teach because I got it all right.
Mhm.
I teach what I teach because I did it all
Yeah,
wrong.
exactly. I love that. I think that's so
you
true.
know, like I'm not perfect, whatever. When I began to work in this field, I quickly realized that school didn't teach me enough about tongue tie. I wanted the opportunity to learn firsthand from an experienced professional. I had so many questions. Can you relate? Good news. I've created the Professional's Guide to Tongue Tie in the Breastfeeding Infant just for you. You'll get 4 recorded video modules, downloads to share with your patients, admission to a thriving multidisciplinary community for networking, sharing, and continued learning, and 4 LSERPs. All the details are on the website at tonguetieexperts.net/pro course. Use code podcast15 to save 15% off this and all of my courses. Can't wait to see you in the group. So your first son is 10?
He's 11. So
11. And what was that like?
So he was, I went in and I had him. I was 39 weeks and 3 days, something like that. It all went really well. He was born. I didn't know anything about like golden hour or anything. They just took him and they're like, "Oh, he has lots of hair." And they went over and weighed him and cleaned him off. And I'm like, what's going on? And then they bring him back.
Mhm.
And I remember so vividly him coming back and just having this a little pucker on his face, and they're like, "He's hungry, feed
Mhm.
him." And I'm like, "Okay." Because didn't know, like, there was like a 30-minute
Mhm.
breastfeeding class during my hospital prep class, and one of my sisters
Mhm.
had asked me earlier, "Oh, are you gonna breastfeed?" And I was like, "Probably, I don't know, that probably what I would
Did
do."
your family breastfeed?
Yeah, so my sisters, I have 3 older sisters, and they all had breastfed their babies, and my mom
Oh,
did as
okay.
well. But it wasn't it's like, I remember my mom breastfeeding my little brother because I was the youngest, or the second youngest of 6. So my little
Mhm.
brother, I remember her breastfeeding him in her chair when he was, like, 18 months old, and that's, like, the one thing I
Mhm.
remember. But then my other
Mhm.
sisters had, so they were very, like, they were supportive, but, like, it wasn't like, I did have that,
Right.
but it wasn't something we really talked about that much, like, it was just,
Right. It was
whatever.
just understood that that's the way you fed your
Yeah, so then
kids,
when they
right?
handed him to me, I was like, "Okay." And then I'm like, I don't know, and, like, the nurse would, like, come over and help me, and I had to have her come in every single time to latch him because I just did not know what I was doing, and I remember that I had
Mhm.
so many pillows all around me, like, it was ridiculous when I think about it. It was, like, 5 or 6 pillows, and I could only
Mhm.
nurse him in the football position, but it seemed like we went home, and, like, right before we left, a nurse came in, or a lactation consultant came in, and she goes, "Oh, you're gonna have a really hard time nursing because you have flat nipples." And I'm like, "What?"
Oh, I hate
I was, like,
that.
so confused because he was nursing at the time. She's
Right,
like, "Here's my
right,
card, you can come see us," and I never did because I was like,
right.
but then we went home, and, um, I thought nursing was going well. I had a lot of pain, and I think some of it, I don't even know what it was. Like, I felt like it was like
Mhm.
lightning bolts, and it was like I called the hospital afterwards, and they're like, "Oh, that's normal," and I'm like, "Okay."
No.
Yeah, it's not,
Yeah,
no.
yeah.
But I was like, "Okay," because I just, fully trusted everything that they said, which, I mean,
Right,
there's a balance with that of,
right.
you know, which I'm sure you understand. But, um,
Yes.
so, we just went on, and he had some slow weight gain, but it was never to the point where they were like, "Oh, you have to stop breastfeeding." It was kind of like, "Oh, let's
Mhm.
watch." And, he would gain some weight, and he had really bad reflux, like, his entire first, like,
Aw.
really, like, because I know a lot of people say, "Oh, they have reflux," but it was so bad. Like, he would cry
Mhm.
for hours and hours for, like, the whole first year, especially at night. He actually had an EGD at one point, and they're like, "Oh, yeah, he has active reflux," and we're like, "Okay, well, I don't know what to do." And at one point, I
Mhm.
remember, like, he was always smaller. a smaller baby, but I always breastfed him. And, I was also very much in you have to feed every 3 hours, not any sooner, not any later. I always say if I had fed him
Mhm.
more frequently, I think he would have been a happier baby because I just thought,
Mhm.
because they told me at the hospital every 3 hours. So that's what I did.
Mhm.
Um,
Do you know that that's still being taught,
yep,
which is very frustrating,
it is.
and I have quite a few people who have come to me complaining, or what their concern that they're coming to me for is that the baby has colic,
Yeah.
which is, colic. That's what you described
Yep.
in your baby, that's crying every night, and or gas, quote unquote
Yeah.
gas. And so many of those babies just aren't eating enough. And I'm not saying this to make you
Oh,
feel
no, no.
better. You already know
Yeah,
that, right?
absolutely.
But I think that that's a teachable moment because most newborns only cry when they're hungry, or feeding them will solve the
Yep.
problem, no matter what it
Yep.
is when they're newborn,
Nope.
right? It's rare. It's rare that you have a baby that latches and won't isn't satisfied when they latch.
Yep.
It's a different story if they can't latch.
Yep. And
It's a different story.
I think that's really, I think that's so true because I found that with myself,
Mhm.
with my third baby. By the time he came around, I nursed him all the time just because if he was crying,
Right.
and he was a much happier baby. He was also a much chubbier baby because,
Right,
and he
right,
still
right.
did kind of have some, it seemed like maybe a little bit of reflexy, but it wasn't nearly as bad because I
Mhm.
just nursed him and he was happy and everything was, and
Right.
that was, that's kind of jumping ahead. But with Jack, my
Yeah.
oldest, I remember at one point the doctor's like, "Oh, he seems like he might have like a dairy allergy. Maybe you should just give him
Mhm.
soy formula." And I was like, "No way, we're
Ugh,
not doing that."
right.
And I switched doctors. And I had a hard time finding a good pediatrician that first year because they gave us all sorts of weird advice when he was 6 months old. They're
Mhm.
like, "Oh, he's still waking up at night. You need to just leave him in his bed. If he cries and throws up, don't do anything because he's
Oh
trying
my
to
goodness.
manipulate you by throwing up." And I was like, I walked
Oh,
out that door and finally we
yeah.
found a really good pediatrician that wasn't so fixated on his weight. Because he was smaller, but he was healthy. He was meeting all his milestones. He's very, very, like at age of 10, he's still smaller. But
Mhm.
my husband and I aren't giants either.
Mhm.
And he's
Mhm.
very, he's never had any issues. So, that was frustrating. And sometimes I wonder,
Mhm.
like back then, I never knew anything about tongue ties, anything about like feeding or oral, anything that, could have been fixed like with chiropractic or anything like that. I just kind of like, okay, well, we'll just get through this.
Mhm.
And so looking back, like, and I look at him, he actually has a pretty, and this is where I'm always like, you can't always go off of what it looks like because if you look at his tongue tie, or he has the tie that's a lot more forward than his brother who had a lot of issues. And so sometimes I'm like, maybe it was something with that, but it is what it is.
But all the other things are
Yeah,
okay
he's
for
never had any
him.
other issues. Like my second son has a lot of different issues that may be related. But this one,
Mhm.
he never had speech. He never had grinding teeth, never had sleep, like anything like that.
Mhm.
So
Mhm.
it's one of those things where maybe it would have,
Yeah.
but who knows? But
Yeah.
I breastfed him.
Just something to be aware of, right?
Exactly.
Because you never know in the future
Mhm.
what could
Yeah,
happen, right?
because I have a tongue
So
tie
so
too. So
your second son is how old? Like,
he
how much of its space was
there's
there?
3.5 years. I was
Mhm.
kind of, I always wanted to have lots of kids, but after that first one, my pregnancy was really, I had a really terrible pregnancy. And then he was such a sweet baby, but he cried all the time. I was just like, I just don't think I can do this again. But then
Mhm.
my son, he just kept asking for a sibling. Like at like 2.5, he's like,
Aw.
I want a baby. I want a baby sister. He not ever had a baby sister, but he just asked. And so I'm like, okay. And I'm so grateful because I love my kids and I couldn't imagine without them. But they're 3.5 years
Mhm.
apart, which has been wonderful. And with Oliver, he's my second. I just figured I would breastfeed because I breastfed Jack till he was about 23 months when I had to go on a medication, which looking back now, I did not have to stop breastfeeding for, but they told me I had to stop
Oh,
breastfeeding.
I'm
So I
sorry.
kind of weaned him, but he was easy to wean. Like he was just kind of like
Mhm.
done. And I was like, okay, well,
Mhm.
great.
They're very busy at that age,
Yes.
right?
Yep. So he was really easy to wean. And even though he cried a lot, he's always been a very easy child, especially after that first year. So finally, I got pregnant with Oliver and I had him. His pregnancy was also difficult. I had a lot of challenges. I had a lot of dental work done at one point, and after that, like, he had been very active, and after that he kind of stopped being active. And then shortly after that, my placenta stopped growing, which we didn't realize until he was almost born. So he ended up being IUGR because he basically stopped growing about 32, 33 weeks. And he was also breech, and so we had all sorts of frustrating things going on.
Right.
And so he was born at 39 weeks, just went into labor on his own. I had a partial placental abruption, which they didn't really realize until he was born.
So for those who don't know, that means the placenta starts to separate before the baby's born. And IUGR is intrauterine growth retardation, which means that the baby just doesn't grow as fast as they're supposed to. So they're a little smaller than you'd expect because there's a little bit of a decreased blood flow through the uterus to the baby. And so he lasted inside to 39 weeks. And was he born vaginally?
He was. So
breech?
No, he was breech up until 38 weeks. So I went. This is when we realized he was too small, because I thought he was too small when they were doing things, and they were just like, oh, whatever. So we went to get a second opinion from a doctor that actually delivered breech babies, and he's like, and we went to chiropractic every day for a week. Up into that. And then we got there and he's like, this baby's no longer breech, but he should have been born yesterday because that placenta is in bad condition. And so he sent us to the hospital, but then the doctors there were like, oh, he's just scaring you. There's nothing wrong. He's, oh
my goodness.
But then he was born, and I had that partial placental abruption. I was bleeding throughout my entire delivery, which was really scary. But they're like, oh, it's not enough to do a C-section. And then it was born, and they're like, oh, he was born. And the placenta, they're like, oh, this has a bunch of like dead tissue all over it. It's almost super small. The cord is really, like, we're shocked he even flipped.
Wow.
But he was about 5.5 pounds full term, which, I mean, isn't the tiniest, but it was small. But he came out and they put him on me, and he breastfed right away. And it was wonderful. Like, he breastfed just beautifully right there in the hospital. They did have to check his blood sugar twice. But he was just fine. So, that hospital experience was great. Like, they left me alone. They were like, you're wonderful. My milk came in within 24-ish hours, which was wonderful. And so it was great. But then we went home, and things just were bad pretty quickly. It was very painful. I ended up going into the ER about 8 days postpartum because I had a really bad fever. And at that point, I just didn't know what was going on. And I was like, am I sick? And I had this terrible fever. I had like clogged ducts, all this. I go in, they're like, oh, you probably have like the flu. Like, they didn't even check like my breast to see if I had arthritis. And I didn't think about it either. But then they loaded me up on this cocktail of Benadryl and Reglan and weird stuff when I was in the hospital. And that was weird. A weird experience. I'll never take Reglan again because of that. But then we go home, and it's still very painful. He's not gaining weight. And I think at first he was, but then he stopped. And I think part of it's because of the stress of everything going on. Right. And he wasn't waking up very much either on his own.
Are you a solopreneur or small business owner? If so, I want to ask you a question. Do you know exactly how much money you made in your business last month? Or can you find this number right now with just a couple of clicks on your computer? I'm Sarah Finns, finance coach and accountant and creator of Easy Business Bookkeeping, a course and system for tracking your business finances with ease. I want to bust the myth that managing the money in your business needs to be time-consuming and stressful, or that you need to be a finance professional in order to understand them. With Easy Business Bookkeeping, you will get the tools and support you need to finally gain clarity with your finances so you can grow your business and your impact. Want to learn more? Go to www.sarahfins.com/TTE podcast for details. That's sarahfins.com/TTE, like tongue tie experts, podcast, and I'll see you on the inside.
The other thing, Katie, which I don't know if anybody mentioned to you at the time, is if you had that much bleeding, you were probably very iron deficient.
And no one said anything.
Yeah. And nobody does, as long as your hemoglobin is fine, nobody checks your iron. And it's a very frustrating aspect for me because I've been in both sides of it, as a midwife, as a lactation consultant. And, when somebody has a baby, usually you don't see them again for 6 weeks, which is ridiculous.
Yeah.
But just because the hemoglobin is high enough, that's what they test to make sure you're not quote unquote anemic after a baby in the hospital. But they don't check the underlying iron.
Yeah.
So if you've had that much bleeding and you were already pregnant, your iron is like very depleted.
Yeah.
And then, so how's your body supposed to make good breast milk with all that depletion going on?
Yeah.
Right?
And I know that, but now that you're mentioning it, I didn't even think about that. Like,
putting the pieces together.
Like nobody really cared what was going on with me.
Right. It's so sad.
Yeah.
But you know what? I'm glad you're telling this story because it's a typical scenario.
Oh, absolutely. I hear it all the time. I see it all the time, but people are like, oh, it's normal. But I was like in so much pain. Like I remember just like curling my toes, like trying not to scream because it was so painful. So finally, like I had heard some things about tongue and lip ties, and I noticed his lip was really tight. And so I sent a picture to the doctor, and she's like, oh, you can come in. And so we went in, and she just kind of was like, and this was, my timeline's probably a little bit weird at this point, but he was probably 10 days old, and he was about a half an ounce or 2 ounces. No, he was a half an ounce from his birth weight. And which I thought was great, but the doctor was like, oh, that's not good. Like he's probably not getting enough. So she had me do a weighted feed right there, and he transferred 2.5 ounces, which she said was not
wonderful.
Good. She said he should be transferring 4 to 5 ounces.
How old was he?
He was 10 days old. And he was 5.5 pounds.
Oh my goodness. That was beautiful.
I know. And knowing that now, but I was like, oh no. And she's like, you're going to have to start giving formula. And she's like, you need to rest. So don't pump. And there was a lactation consultant in the room, and you could tell and like the doctor left the room, and she's like, I can't tell you not to do what the doctor said, but she's like, go see a lactation consultant. So I was like, I'm not going to do that. I'm not going to just go give, because like I knew enough to be like, that doesn't sound right.
And your instincts.
Yeah.
Right?
Exactly.
Like we downplay mom's instincts, but really it's your instincts that pushed you along, 100%. Right? It didn't feel right to you.
Yeah. And I was just like, this doesn't seem right. And it just started this. So I went to a lactation consultant that was through this hospital, this Kaiser. I don't know if I should say that or not, but a hospital system. And so they're very, it's kind of like a conveyor belt in there. But I went to a lactation consultant, and she was really good, but there's some things that happened that probably weren't. She was a little bit more on the militant side of lactation consultants, and he wasn't pooping at that point. He had always had a little trouble with pooping, which I was like, I don't think that's right. Like that he would go, like it was really hard for him to go to the bathroom, which was the opposite of Jack. Jack, it was like 10 poops a day for the first 2 years of his life. So this one, it was like the complete opposite. And she was like, oh, it doesn't matter. Pee is key. That's all you need to care about. And I did a weighted feed there, and he lost weight. And she's like, oh, it's fine. Don't worry. And then I was like, what about this tongue, lip tie? She's like, oh no, those are not a thing. Those are just ways for doctors to make money. Or dentists to make money. And I was like, right. Oh, okay. And she gave me some advice, and and I got some donor milk at that point, because I was like, he needs to get something. And so I got some donor milk, which she was helpful with that. Then I went back to the pediatrician, and she was so upset. We went to the lactation consultant. So she was just, wow. She was very against the lactation consultant. And at that point, he's not gaining weight. And she's like, oh, he's failure to thrive. You need to go and be pumping and doing all this stuff. And she admitted him to the hospital at that point. And I'm like, what is going on? And we get to the hospital, and they're like, why is he here? And it was like, it was a terrible experience, because the lactation consultant was wonderful there. She was so good, but everybody else, it's a teaching hospital, it was a teaching children's hospital. So we were seeing so many different doctors. And I remember they came in, they weighed him, a naked weight when he got there. And the next day they came back, and they said, he's gained 12 ounces overnight. This is I was like, and it's because they weighed him with all his clothes on and the blankets and all this stuff. And I'm like, but at that point we'd had the doctor come in, like the head doctor, and he's like, stop pumping, just feed your baby. This is ridiculous. There's no reason you should be here. And he's like, and at that point it was still painful. I still had a lot of clogged ducts, like lots of clogged ducts. And the lactation consultant, we were doing like weighed feedings. And at that point he was eating like 2.5 ounces at a time. And he started gaining weight and they were like, you're fine, go home.
But you were still uncomfortable.
I was still very uncomfortable.
Right.
And that started this. We still had issues with the pediatrician because she was convinced he had something wrong. She was convinced he had like a metabolic issue. And looking back, he did have reflux too. And I think a lot of it was just the feeding. He was not feeding well, and I was in pain. So it was just this constant battle. Like I still have anxiety going to doctor's offices because of that experience of waiting for the number to pop up on the scale. So at that point, I actually got a scale, which I don't recommend doing this for most people because I got obsessed with it. I weighed him every single feed.
Oh no!
And to do it, for me, I got a little obsessive about it, but it helped me a lot because I realized he needed to eat more frequently. And so at the point when I started feeding him every 90 minutes is when he started gaining weight but I was still
because he was small and he could only tolerate small amounts. He probably didn't have a lot of energy for a long feed to take more. And that was leaving your breasts confused. And that's why you were getting the clogged ducts.
And we were doing bottles, I was doing pumped milk, which I was very grateful that I was able to do that enough. And we had a little bit of donor milk, which was great. But I wasn't taught, I didn't know how to feed a bottle. So, I'm just feeding, like this. And so then he was having trouble latching after that. And so it's like, I would get in this routine where I was bouncing up and down, standing in the dark, like trying to get him to latch. And it was ridiculous.
Yeah. But you did it.
I did do it. And that's why I'm like, and I, no judgment to anyone that stops, but me, I was so stubborn because I had people like, just stop, just give formula. Like, this is not worth it. And I'm like, I know I can breastfeed and I'm going to it's the last thing I do.
So I was one of those moms that stopped. And if anybody wants to hear my story, I was interviewed on someone else's podcast and she gave me the recording and I posted it. So my story is there. I won't go into it today, but I was told by my pediatrician that I was starving my baby and literally my nipples were like coming off. That's how badly she was latching and I gave up.
That's so
and
funny.
I was so upset. Like to this day, it triggers me to realize. And she was a wonderful pediatrician. She just did not know about breastfeeding. And she told me I was starving my baby. And when I looked back at the baby book, she had only lost 6% of birth weight.
That's crazy.
But she was little too. She was 6'4".
Yeah, so she's tiny.
So that weight loss made her nervous,
Yeah.
the pediatrician. And there was no lactation consultants here.
Oh, I'm sure.
I was the first lactation consultant in private practice where I live.
Wow.
So until that happened, there was nobody. There was a couple of people in the hospital, but they were hospital based and didn't really know care beyond the hospital at that point, So anyway,
no, it's crazy though. And I could go on about our journey to find good pediatricians too, because we eventually did find a good one for him because I was like, I cannot go here anymore. And so we found another one and she was a lot more supportive. She was like, I told her the story, like everything. And she was just like flabbergasted, especially when she knew he was IUGR because they were really big on trying to get him to gain a lot of weight because they're like, he needs to catch up. But no, like with IUGR, there's a lot of different opinions out there. And what I found was that they're like, that's actually not the best thing to do the bunch of catch up weight for them. Like it's just, so that's a whole other thing. But I breastfed him and it was very painful though. I breastfed him for 2.5 years. He was so hard to wean. I still joke he would probably still be breastfeeding now if I just had to stop because towards the end I started getting demer. So I had milk ejection, the depression, like really kind of associated with him latching. But it was very painful, especially when he got his teeth in. He wasn't biting, but it was just like daggers. So that's about 6 months. That's when I had learned more about tongue ties. Heard about a really great dentist in our area that people said specialized in tongue ties. And so I looked him up and I made an appointment because I was like, I just want to see what he says. And I didn't really know what was going to happen. So I took him in. He took us into this little room and asked us some different questions. And he was like, he did an exam, like a full oral exam. And he's like, he definitely has a tongue tie and a lip tie. And he's like, if you want, we can go and release it right now. And I was like, I don't know. Because it was like, I didn't know it was going to be like right then. But he was very kind and very like, it's up to you. And I was like, well, he's finally gaining weight at this point and doing well. It was just really painful. And I was like, my gut was like, just leave it. Like, you don't want to have to deal. Cause at 6 months is a little bit harder to release.
Yeah.
It's just still the same process, but the recovery, I'm sure, is a little bit.
Plus it's not good to just go into it cold without preparing. You know that now.
Yeah.
Right?
And I think this doctor knows that now too, because he's still very well regarded in our area. And I think he would probably have, and they had a lactation person there and stuff. But I think he would have been, because I think he'd be different now. So we just kept going and I breastfed him. It was painful the entire time. He started getting decay on his teeth, like, and all this stuff. And it was, which, regular dentists were like, oh, it's because you're breastfeeding at night. So you need to stop that. I'm like, I don't know. So we just went along. And he actually fell and broke his lip tie when he was a year. It was a lot of blood, but they always tell you, a lot of doctors will tell you, oh, they'll just break them eventually, which it's a little traumatic, but it was just really painful. But I just kind of got used to it. It was just one of those things where it's like, I knew it was painful, but I was just like, it is what it is.
Right.
So I weaned him. And then at the age of 3, I can't remember why, but we took him back to that dentist and he's like, you could release it now. And he's like, but I'm kind of split on he's like, it could be beneficial. I think it was because of some sleep apnea, because he had sleep apnea as well, my son, from the time he was born. And he was grinding his teeth from the time he got teeth. And I think it was something with talking about those things. And he's like, you could do it. You could just wait. And so I was like, at that time, my son was very, very scared of doctors and dentists. And I think a lot of that's because of his early experiences with doctors and dentists.
Of course.
But I was like, I just don't want to do anything that's going to cause problems. And so I just didn't. And, around the time I had my third son, when Oliver, my middle child, was 4. And, he was born, I had gestational diabetes with him, and he had a bunch of blood sugar issues in the beginning, which was frustrating and a whole other story. But but I breastfed him, and he was doing great. My milk came in really, really fast. I've always had a lot of milk, which is good. But then I started noticing that same pain. But at that point, I was like, this is not normal. So I called a lactation consultant. She came and saw me. She did an oral examination. She looked at my breasts and my nipples, and she's like, he has a tongue tie, like, go see somebody, like, and she was very helpful. So I went to another doctor in the area because I would have gone to that same one, but I needed to get in more quickly. So I went to this other one, and all he does is tongue ties. And we went in, and he's like, yep, he has a tongue tie. Let's and you're in so much pain, we can release it right now. Which we did. And I still have this picture where I breastfed him and it was not painful. And I cried because I was like, I forgot that it didn't have to be painful. And so things went well with him. Like, he gave me all the stretches, all the exercises afterwards. We did CST. They recommended that. And so we did that. And I actually felt like that the tongue tie helped with the pain, but I feel like the CST helped him actually nurse better. So we did that. We did chiropractic. And everything with him was so much better. It did kind of reattach because I wasn't doing the stretches well enough. I think so. It reattached when we went back for the check at like 6 weeks after or whatever. And I had noticed it started being painful again. So we redid it. The dentist just kind of broke it with his finger. He stretched it. And I was like, oh, that was kind of weird. But it wasn't like super bad reattached. But then we went on and I breastfed him. He had no issues. He's had no teeth issue, no teeth decay, which my first 2 did at a year. And people were like, what are you feeding them? Like, are you giving them candy and juice all the time? And I'm like, no, I'm not doing that. But then with with Andrew, we had no issues with anything. And it was like a smooth sailing thing. So he didn't have issues with, anything after that point. But that's good. But then so comparing that to Oliver, I kind of, it's like, I go back and I'm like, I wish I had known
Oh, yeah.
And who knows if it might have still had a different issue.
Right.
Just because.
You know what? I just want to talk a minute about that tooth decay issue, because I don't know if everybody understands it, because as you mentioned, so many times breastfeeding is blamed, but what the research shows is it's not the breastfeeding, it's the milk pooling because of the lip ties and the tightness in the mouth that's causing the milk to pool, and that will cause decay. So it's not breastfeeding per se. And there's more tooth decay when a baby is put to bed with a bottle of formula than breastfeeding at night. So just to clear that aspect up.
Yeah, that is a little bit.
Yeah,
are like, what are
it's controversial.
It is
controversial. And yeah, as is everything that I deal with. But
but even after we stopped breastfeeding, my son had so many cavities. Like, it was so many, and we're like, what is going on? And so it was my middle son, and it was just so many, and we just could not figure it out, like what was going on.
But again, nobody's looking at what was your health like in the beginning when you were making breast milk for him, right?
Nobody would.
You were depleted. You were definitely depleted after that pregnancy and after that birth. And nobody's thinking, oh, maybe we should support Katie more.
Like,
that's why.
What are they doing? What are they feeding him? Like, obviously,
so
parents. Just kidding.
One of my what's the word for it? My focus this year has been more about talking about the mom or the parent, the breastfeeding parent, because we have a lot of people taking care of babies who don't have it in their scope to take care of the mom as well. And then we forget about the mom. So we could stand on our heads to get the baby to breastfeed. If things aren't well with the mom, baby's not going to breastfeed. I have a whole presentation that I'm putting together for a conference. I'm very excited about it
because it's wonderful.
And it's for speech language pathologists mainly in the audience, because they have it in their scope to take care of the baby. And sometimes I get frustrated because I'm like, well, you still have to evaluate the breastfeeding. They're like, well, we know what it looks like when the baby's latching. I'm like, but you're not. It's not in your scope to examine mom. It's not in your scope to know what's wrong or not going well for mom. It's just not in their scope. So not to put down any of my SLP friends who I love dearly, but we often forget, and this is a perfect example of nobody was like, well, what about Katie? What's going on with her? Yeah. And even in my own breastfeeding failure stories, there was stuff going on with me that nobody was putting it together, that maybe that's why things weren't working out.
Absolutely. And I think there's such a connection between it. And I think we're just learning a lot of that now. Like, and it's true. People don't look at the mom. They just think, baby's here, mom, off to the side. We don't, nothing.
As soon as baby's born, we don't need, the pediatricians don't need the mom, and the obstetricians don't need the baby. Nobody's looking at it together. The goal of the OB is to get that baby out safely.
Yep. And the only time they talk about mom is if they're saying, oh, your milk, because I was told that my milk wasn't fatty enough, is what the pediatrician said at one point.
And your nipples are too flat, or too this or too that, or the other thing.
It's obviously something wrong with you, but no, we're not going to just get formula instead.
Right.
But so anyways, with kind of the endings, so we're in the middle of this with Oliver. We finally, because he has just had a lot of different interesting issues over there. So he has sleep apnea, he snores a lot, and we got his adenoids taken out at one point, but it didn't help. And he he's grinded his teeth since he was 6 months old, and he's 7 now. And I kept bringing it up to his dentist, and she's like, oh, kids, like 70% of kids grind their teeth. And so I looked that up online, and that's not true. It was like 30%. And they say by six, they should probably be stopping. And even then, it's not like, oh, that's, let's grind our teeth. That's a great idea.
Right.
So I was like, that just seems weird.
Common is not normal.
Yep, exactly. And so, and this dentist, we really like her for certain things, but she was always very big on breastfeeding causing cavities, like no question.
So she's not an airway dentist.
No, she's not. She's just a regular pediatric dentist.
Yeah.
And so I was like, okay, I like her. So I'm just kind of like, okay, let's just, she can do whatever. But with, we ended up, he had some, I noticed he was like gasping for air at night, and he's always very tired. Like he's just kind of like a low energy, which is, some kids are, but it's just didn't, and his sleep is not, it's just not that great.
Right.
And so, I've just been putting it off because I'm like, I know we'll have to go through I knew it was going to be expensive, a lot of the process.
Mm-hmm.
And so finally we took him to a third dentist in this area because I had heard really good things about her. She was a little bit easier to get into. She wasn't as busy as the other ones. And that's nothing against the other two that we've seen because they're really, I think they all work together. They're very good dentists.
Mm-hmm.
But we went to this one. We went in and she's like, kind of tell me what's going on. And she did like a very, very thorough exam. Like I was very impressed with what she was doing. And part of me went to her because I wanted to see what she did.
Right.
And she was like saying all sorts of things, like writing notes, and they took some pictures, and she's like, he definitely has, a tongue tie. She's like, he can't touch the roof of his mouth. He can't lift it up. His tongue, and she's like, is his mouth kind of open all the time? I was like, yes, like he's just open. And she's like, that's probably why he's getting all this like plaque on his teeth because his mouth is just open. And she was like, yeah, I can see his tongue. His lip tie was had broken. And but then she's like, his tongue doesn't lateralize to one side. His bite's really off. Like, so it was just kind of, there's some weird things going on. And then they did like a airway, like they did a whole like 3D thing of his head. I don't really understand what it was.
Right.
But
it's actually like a specialized CT scan.
Yeah.
Right.
Yep.
Yeah.
And so since she showed us from that his airway was just super narrow, like very, very narrow.
Which is not surprising. Given
just all the issues. And she's like, it's just very like, there's just not any like, and she was like, if you look at his face, he has 2 dimples. And so she's like, he definitely has buccal ties, like she showed us. And I had at this point, I've taken your course. I've done a lot of research on tongue ties. So I've done kind of some oral exams on him myself. And I was like, I know that there was things there, issues going on. And just based on the symptoms. So at that point, this was just a couple weeks ago, and she was really great. And she's like, these are kind of some options. And she's like, I don't recommend doing a release right now. She's like, we need to fix kind of the teeth and the jaw. Because she's like, if we don't fix those down the line, he's going to have surgery on his jaw.
Right.
So we are doing spacers. She just got I don't know if it's a spacer. I think that's what it's called. Like
something to do some expansion, probably.
Expander.
Right?
Expander. That's what it was. So we're doing that. And then she said, we'll do that for 6 months. And then at that point, we'll reassess and do CST and then see if the tongue tie release is still necessary at that point. So that's kind of where we're at now. And it's hard to know and I kind of mentioned this, I think we talked about this a little bit, that I don't know if these would have been prevented if we had done the release a long time ago, or if it's just what still would have happened.
Yeah, and there's no way to know. Yeah. And there is no way to know. You could do everything, and there's many babies that, including my own grandson, that we seem to do all the things, quote unquote, right, and the high palate persists, the lack of extension and lateralization of the tongue persists. My daughter is suffering. I hope she doesn't mind me mentioning this. He's 16 months and she's on the verge because he's really not opening his mouth well. He chomps on her nipples. It's really, it's so frustrating. And I give her all the credit for everything she's done up until now. And I wouldn't blame her if she would quit, but she can't because he won't. He just wants her too much.
That's like Oliver. It was like I couldn't stop if I wanted to.
Yeah. It's not an option to stop completely, unless she moved out or something. But anyway, so sometimes we can do all the things, and it's still not enough. But I like to think about if we didn't do anything, like even the work you're doing with Oliver now, where would he be 5 years from now?
Yeah.
Right. So like we're doing the best we can when we can, and there are some kids that if they don't get it done in the beginning, they're not going to eat at all.
Yeah.
I mean, I've had plenty of babies, they're not eating, they're not transferring any milk, not even by bottle. So it's either do this and see if it works or think about a feeding tube, so there's that. But it's not a guarantee that everything's going to be amazing for their whole lives. Right. But the one thing that I would add to your descriptions, and I'm hoping that you're just overlooked saying it, but myofunctional therapy has to be
Yep.
in your son's
Yep.
picture, right?
Yep.
Yeah.
That was a bit, and she has one of those in her clip, like,
Beautiful.
so
beautiful.
she's wonderful, and she's like very, and I've,
all right, give her a shout out.
yeah, it's
we need to shout out the wonderful doctors
Dr.
and
Turner
dentists
at Fox Point Dental, and I haven't actually mentioned to her that I've like in lactation or anything, because I've kind of just
really
I haven't yet, just I probably will the next day, just because we were just talking a bunch, and I just
right.
But I'm like,
and where are you located?
I'm in Colorado, so I am in Littleton, Colorado.
Okay, great.
And so
my best friend lives in Telluride.
Oh, very cool.
How far is that from you? That's pretty far.
Yeah, I think that's like 5 hours.
Yeah. Well, in Colorado, that's not far, though.
No, it's not.
My girlfriend drives an hour and a half to the grocery store.
Yep.
So
yeah, nope, it's so true.
I love Colorado.
Yeah,
it's beautiful.
It's
there.
a wonderful place, and we're lucky because we do have some very great physician or dentists here,
providers.
And with Oliver, he actually has a posterior tie, which I think is what made it even harder in the beginning, because we took him to an ENT, and I had said something about a posterior tie. He's like, "Oh no, that's not a thing.
Right?
That's not a thing."
ENTs don't believe in that.
Yeah, he's like, "That's nothing. Like, he's fine." And I'm like, and that's kind of where I was like, I've become a little bit. And with Andrew, I forgot to mention, we took him into my pediatrician before I called the lactation consultant, and she's like, he absolutely has a tongue tie, he has a lip tie, and she's like, I get a lot of pushback from the medical community around here because I believe in tongue ties, and she's like, but my son had a horrible tongue tie, and she's like, part of my nipple like broke off because it came off because of, and she's like, I came so passionate about helping people realize when they have one, and she's like, but she was great. So that was also a little bit more for me, like, okay, I need to see somebody, and I did, and and I'm grateful for that. But
and I have an Andrew.
Yeah,
my son is Andrew, my oldest. He's about to turn 32. My Andrew.
So he's my same age.
Yep. So Katie, I mean, you've been through it.
Yeah.
And I honor your experience and your perseverance and your ability to take a negative experience and use it for the good of others, because we could go in any direction with that. We can go hide under a rock. We can I know after my second kid, I was ready for the insane asylum.
Absolutely.
It took me a long time to recover and come back and decide to teach about breastfeeding, and that only came because I became a midwife. Like, it wasn't even a direct route. So what you're doing is amazing. I love that you're becoming an IBCLC, because I know that you're going to be such a great addition to our profession.
Find out in June. So we'll see.
Yeah. Oh, you'll pass.
I hope so.
We need more passionate women like you in our profession. And I don't want to keep people too long, but if you'd like, just tell, I'm going to have it in the show notes, but you can be found. Do you have a website? Are you just on Instagram? Yeah. Tell us where we can find you.
So I have my website. It's called thebreastfeedingmama.com. I have tons of articles. We have breastfeeding courses, virtual consults, all sorts of things like that. So you can go to thebreastfeedingmama.com. I'm also on Instagram, and I have a YouTube channel as well, but it's just Instagram and my website that I do most things on. And
excellent.
But I'm super grateful to be able to share kind of my story, because I think it's more complicated than people think. Because even now, I'm like, maybe with my first son, I think it was a good choice, or with my third, getting the release done. But I'm like, I do think CST, there's a lot of the myofunctional stuff. Like, it's very, like, chiropractic can actually be a good step for something like that, can help a lot of people.
Right.
So I think it's just important to see that. And when I was sharing a little bit about Oliver on my stories recently, I had several people be like, why didn't you do something before now? And I'm like,
aww.
And I'm like, it's a complicated, like, it's hard,
right?
Because he's older, and part of it's because of me. Like, I have a tongue tie that, when I saw a dentist, he's like, oh, you do, you just need to go through all this process though. And I'm like, but I have I grind my teeth really bad. I have really bad reflux. So I have a lot of different things where I'm like, maybe it's related, maybe it's not. But I'm like you said, it's like, what would 5 years from now look like for Oliver?
Right. And you can only handle what you can handle, and nobody should judge anybody else.
Absolutely.
for what they do and what they can handle. And I mean, there's only so many hours in the day and so many,
We have so many things.
so many doctor's appointments you can go to. And, I have a friend that's got 4 kids and she's going through 3 of them with expansion and all kinds of things, and very interesting. I'm hoping to talk her into coming on. Her teenager has scoliosis.
Oh, interesting.
And it's being linked to the tongue tie because her tongue tie was really severe. So yeah, it's really, there's more and more evidence that because the tightness is pulling to one side, it pulled her whole spine to one side.
Wow.
So yeah, there's lots we can look back on and say, I wish I did this, or I could have done this better, but we can only do what we can do and give ourselves grace around it and just support each other on our journeys, right?
Yep, I think that's the most important thing, is just being supportive and being supportive to other people and understanding that their journey may look different. Like I got a surprising amount of judgment for not switching to formula with like some people were like, you're very stubborn, or like you just think you're better than other people and I'm like, that's not what I'm saying. Like I just know that I can breastfeed, and I know that that's important to me. So that's what I'm going to do. So I think,
and you made it work.
I did. And it, some people would still see what I did and still say that was not worth it. But for me, it was.
Right.
Especially, it's just important. So I think that's the key, is doing what works for your family.
All right, Katie, thank you so much for joining us today. It was so much fun to chat with you finally.
I know. I thank you so much. It was great. I love talking about things like this. So
Okay. We'll do it again.
Yes,
we'll do it again. All right. Take care. Bye-bye. Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Palladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.